This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
We've already seen Jimmy this afternoon on the eastern shore of Virginia as he prepares to surprise one of two winners in Spicer Brothers Construction's Delmarva's Neediest Roof Contest. And we're getting closer to the big moment, and you really can feel the excitement, huh?
Absolutely. But before Jimmy left, he did sit down with Dr. Chris Snyder from PRMC to bring awareness to something so simple but so important: washing your hands.
And it is fitting because it's Hand Washing Awareness Week. It's a thing. Did you know that?
I had no idea.
I didn't know that either. Here's Jimmy now with some information we all need to keep us healthy this holiday season.
You know, every so often when our next guests come on the show, you won't see us shake hands. Instead, you'll see us do this. The elbow bump. That's because Dr. Chris Snyder, PRMC's Chief Informatics Officer and Hospitalist, knows of everything that our grimy little germy hands can hold. And today we're going to talk hand washing. It seems like a simple topic, but we really want to drive this home because it's important, proper hand hygiene. Why is it? In fact, you were the first one to really get me onto elbow bumping. Why is this so important to you?
Dirt. It is. Your hands touch everything, unfortunately. So you carry it. You know, we have little ones too, our children at elementary school, and bring things home, and,
right.
and you know, you kiss and snuggle them, but unfortunately adults shake hands, and we teach our children to shake hands too. It's a gesture of, you know, appropriateness, but it also carries some risk with it. So because obviously hand hygiene is tremendous, especially in healthcare where people are very sick.
Yeah. So we've seen a reference of hand washing as a do-it-yourself vaccine.
Yeah,
would you agree with that?
Yeah, oh, absolutely. Yeah, it's or you can vaccinate yourself with a live virus by not washing your hands.
Right.
So on the other, you know, again, using the hand hygiene is so important. So healthcare providers, probably in the last 2 decades, have really started to study that and look at our behaviors as far as preventing illness, especially with our sick patients, our chronically ill patients.
Yeah.
They're the ones really at risk, and we all have one in the family.
Yeah, we do. You're right. So we all know after using the bathroom, when working with food, always wash your hands. Are there any other times that to wash your hands?
All the time.
All the time.
Yeah, opportunity is when you're near a sink, when you're near the alcohol scrub. I love teachers. Elementary school teachers are wonderful. They got on their little desk and they decorate it so it looks like kids like to go up and do the pump.
Right.
So it's a good thing. But yeah, absolutely, because handrails, doorknobs, everything that people touch potentially has an illness, and we go hand to mouth constantly.
Right.
So we go hand to touch individuals constantly. So yeah, I mean, the more the merrier. It's not going to hurt anything. Other than maybe some dermatitis that you may get from scrubbing too much,
right.
But that's a good thing.
So I hate to ask this question, but can you tell me what kind of diseases we're talking that we could pick from?
Typically viruses, common cold viruses are most contagious, and they tend to live the best and the longest on the hands.
Yeah.
So those contagions are there. Bacteria, there are certain bacteria, especially again in sick people. Now you and I have bacteria that live on us. It has a purpose.
Right.
It helps us survive our environment, in our gut, in our skin, on our face, and our mouth. The mouth is the dirtiest. So those things are probably good to have. What happens is you get an overgrowth of infections. So the more you seed yourself with foreign illnesses, and that's why little 2-year-olds, when they go to preschool, come home and mommy and daddy, first-time parents, get sick because they have not been exposed to those little buggies they got from the nursery school. So there are those, you know, again, you got to protect yourself, teach your kids early to use hand hygiene, and you see it everywhere. The alcohol scrubs have been a huge benefit for all of us.
Always a good thing. Now, when we're washing hands, is just soap and water good enough?
Absolutely, yeah. Soap and water. The key's not really the soap and water. That just kind of gets you there. The friction is what you want. So in between the fingers, under the nails, good nail hygiene. All those things are definitely preventative. But it's really the friction, the rubbing of the hands. We actually take classes on this in healthcare and teach environmental folks and the bedside caregivers and the providers all learn how to wash their hands. It's very important. If you watch a surgeon wash their hands, it's extremely aggressive. They actually use brushes and certain chemicals preoperatively to scrub themselves to a sterile field.
Okay, now you mentioned the sanitizing gel, the antibacterial stuff.
Yes.
Isn't that just good enough?
So we kind of use a rule, you know, you use that 3, 4, 5 times. It's always good to go back to the sink and do that good friction rub. The alcohol builds up on your hands, so it's good to use the alcohol scrub in between, but it's also good to hit the sink every few times. And it depends on how much exposure you're getting to those little ones, to the sick ones, to the folks who have colds.
So do you think a lot of people don't wash their hands often enough?
Oh boy, yeah.
That was an easy question, wasn't it?
You know, we do observations in healthcare throughout the country, so, and they have observational data looking at healthcare providers, and really we need to do a better job, I can tell you that. So that being said, we're educated about that. The folks who aren't educated about that, like I said, the elementary school teachers is where it really lives. So teaching kids when they're young to get those habits, those good hygiene habits.
When I go see my doctor, is it okay if I ask him or her to wash their hands?
Absolutely. Yeah, you know, if you're getting a provider who gets a little negative because you've asked them to wash their hands, bring it on. I think it's so important. So I would never take, because it is a defense. And you know what, honestly, we're busy people. We may have been on our phone, which was dirty, put it in our hand, and now we're coming back into a room with a sick patient. So you really want to encourage healthcare, remind each other, not just providers, but remind your family members.
Excellent points, Dr. Snyder.
Awesome.
Thank you again. Appreciate everything you do for us. Now, if you'd like to read more from PRMC about the importance of washing your hands properly, just go to delmarvalife.com.
A practical reminder that something so simple can do so much to keep us healthy.
And you know, there are other everyday habits that can also do a lot for our health. For instance, your morning cup of coffee. It contains the chemical EHT, which has been shown to help protect against Alzheimer's disease. Here are some more habits you might want to take up to help reduce your risk of dementia.
It would be a lot easier to stop the disease from progressing rather than trying to catch up and prevent all of the sort of downstream effects that happen after the disease really is sort of set forth.
So what can you do in addition to drinking that morning cup of joe? Try drinking black and green tea. They're also rich with antioxidants that may fend off damage throughout the body, including your brain. And take up dance. Dancing not only exercises social smarts, but learning new steps help brain fitness, and the fun can help reduce stress. You could also take up crafting. One Mayo Clinic study showed the likelihood of mild cognitive impairment was reduced by 55% in those who took up activities such as woodworking, pottery, ceramics, and quilting. Another option, throw dinner parties. Dr. Kenneth S. Kosick, author of Outsmarting Alzheimer's, says deciding what and how much to serve, who to invite, and who is sitting where forces your brain to contemplate complex social decisions, along with using math and strategic planning skills. And did you know potatoes could be harmful to your health, to your brain health? They contain an amino acid that, when exposed to high heat, can change into a neurotoxin. But the American Cancer Society says soaking your potatoes in water for 15 to 30 minutes before cooking them can prevent this change, protecting your mind.
So you're telling me that I have to wait before I make my French fries?
Yes.
And my baked potatoes?
Yes.
And my anything, I eat a lot of potatoes.
You like your brain, don't you?
Yeah, I do. So I
Well,
guess
there
I have
you go.
to slow down a little bit. All right.